Do you frequently feel like your heart races or your chest tightens when hearing a loud noise, like a car backfiring or a door slamming? Or do you get flashbacks of a scary memory, like being stuck in a bad accident or seeing something violent? That might not just be stress. It could be a sign of post-traumatic stress disorder, or PTSD. PTSD is a mental health condition that can happen after someone goes through a very scary, dangerous, or life-threatening event. Imagine your brain's alarm system is stuck on high alert even when you're safe now. It's like your mind keeps replaying the trauma, even if the danger is gone. And guess what? It's more common than you think. Soldiers, survivors of abuse, accident victims, or even people who have been through serious illnesses can experience it. So what causes PTSD? It starts with trauma. Not every hard experience leads to PTSD, but events like war, natural disasters, serious car crashes, physical or sexual abuse, or watching someone get badly hurt can trigger it. Let's say you were in a terrible car accident. Even months later, just seeing a similar car might make you sweat, panic, or feel dizzy. That's your brain reacting as if the danger is still there. Some people are more likely to develop PTSD based on their genes, past trauma, or lack of support after the event. It's not weakness, it's how your brain is trying but struggling to protect you. You avoid crowds because they remind you of the day you were attacked. You have nightmares that wake you up sweating. You get angry easily, even over small things like someone being late. Or you might feel numb, like nothing matters anymore. These are common symptoms. People with PTSD often re-experience the trauma through flashbacks or bad dreams. They may avoid anything that reminds them of the event, even a song or smell. They can feel tense all the time, called hyperarousal, always scanning for danger. And they might blame themselves or lose interest in life. For example, a firefighter who couldn't save a child in a fire might stop going to work, avoid fire stations, and feel guilty every single day. How do doctors know if someone has PTSD? There's no blood test. Instead, a mental health expert will talk to the person using questions like, have you had nightmares about a past event for more than a month? Or do you avoid things that remind you of it? To be diagnosed, symptoms must last over a month and affect daily life like work, school, or relationships. Treatment works. Therapy like cognitive behavioral therapy, CBT, helps people face and change their scary thoughts. A method called prolonged exposure teaches you to safely face trauma memories so they lose their power. Medicines like SSRIs can help balance brain chemicals and reduce anxiety. Think of therapy like mental exercises. The more you practice, the stronger you get at handling tough memories without falling apart. Can PTSD be prevented? Sometimes, yes, especially with support. Imagine after a traumatic event, a person gets help right away. Someone listens, offers comfort, and helps them feel safe. That support can reduce the chance of PTSD. For example, soldiers returning from war who talk to a counselor quickly are less likely to develop long-term symptoms. Teaching coping skills like deep breathing or grounding techniques, such as naming 5 things you can see, for you can touch, can also help. While we can't prevent every case, early care, strong relationships, and stress management go a long way in protecting the mind. Scientists are learning more every day. One exciting advance is the use of virtual reality in therapy. Imagine a war veteran visiting a safe virtual battlefield with a therapist slowly reducing fear. Another breakthrough is with a nasal spray called MDMA-assisted therapy. Not for recreation, but in controlled therapy. It helps patients talk about trauma without overwhelming fear. Recent studies show it can significantly reduce PTSD symptoms. Also, researchers are looking at brain scans to predict who might develop PTSD after trauma, so help can start sooner. These advances bring real hope. PTSD may not disappear overnight, but healing is absolutely possible.